profile and glucose measuring system is a fast, easy, and portable way of measuring lipid and glucose levels. The CLIA-waived LipidPlus system measures total cholesterol, HDL cholesterol, triglycerides, and calculated LDL cholesterol. This video provides an overview of the LipidPlus analyzer and strips. The product insert and operation manual must be read thoroughly prior to use. The LipidPlus lipid panel test strips can be stored at room temperature. They should be used at a temperature between 64 and 86 degrees Fahrenheit and a humidity between 10% and 90%. Testing should not be done in direct sunlight. When you open the bottle for the first time, write the date on the label. Any remaining strips should be discarded 3 months after first opening the vial or on the expiration date printed on the label, whichever comes sooner. Setting up your analyzer. The LipidPlus analyzer requires 2 AAA 1.5-volt alkaline batteries. To install the batteries, open the battery cover on the back of the analyzer. Insert the batteries as indicated on the inside of the battery compartment and replace the battery cover. To initially set up the analyzer, press the mode button for 3 seconds. Date and time and other settings can be modified by pressing the mode button and selecting the up or down buttons. If you are using a printer, be sure that the printer PTR on setting is selected. If printed results are not desired, select printer PTR off. To begin cholesterol testing, first code the analyzer. Press and hold the down arrow button for 3 seconds. The code RF will be displayed on the screen. Next, place the RFID tag located on the strip bottle label next to the RFID symbol on the analyzer. Once the RFID code is recognized, the analyzer will beep and display the code value for 2 seconds, and then return to standby status. Your analyzer is now coded for cholesterol testing. If you are using a printer, be sure that the printer setting in the analyzer is turned on. The printer should be turned on prior to connecting the LipidPlus analyzer and printer with the interface cable. Before testing with the LipidPlus cholesterol analyzer, please prepare the following items: disposable 21-gauge safety lancet, 1 triple capillary rod, alcohol swab, sterile gauze, small bandage for the patient's finger, lipid panel strip. As with all testing involving blood, medical gloves should be worn by the healthcare professional administering the test, and a biohazard waste container should be available for disposal of items coming in contact with blood. The person to be tested should ideally be in a sitting position. The physician or healthcare professional typically advises the patient to fast 9 to 12 hours prior to the lipid profile test. Triglycerides and LDL results are affected by food consumption more than total cholesterol and HDL. To begin testing, insert the cholesterol strip into the analyzer and briefly press the center mode button. The RFID code will appear and should correspond to the code on the bottle. This will then be followed by the testing symbols for cholesterol, HDL, and triglyceride. The blood symbol on the analyzer screen will blink when the analyzer is ready for the blood sample. Blood collection. Ideally, the middle or fourth finger should be used for blood collection. The finger to be tested should not feel cold. To enhance blood flow to the test area, you can run warm water over the selected finger or gently massage the finger from the lower or proximal portion towards the distal or tip of the finger. Clean the area to be lanced with an alcohol swab. Allow the skin to dry for 30 seconds or wipe dry with a gauze pad. Place the disposable lancet lateral, just off center of the finger pad, and firmly push to make a deep puncture. The finger should be pointed in a slightly downward position. Use the sterile gauze to wipe away the first drop because it may be contaminated with interstitial fluid or debris. Squeeze the finger to obtain a second large drop of blood. Do not milk the finger. If necessary, continue to massage finger to increase size of the drop. Collect the blood sample by lightly touching the tip of each capillary rod to the surface of the large blood drop. Do not touch the finger. The blood should flow into each capillary rod automatically. Inspect the capillary rods to ensure that they are completely filled. Run the test. After the first, second, and third capillary rods have been filled, apply the blood sample to the 3 test areas of the lipid panel strip at the same time, starting at a 45-degree angle. Then move the capillary rods to a 90-degree angle. Never reuse the capillary rod or reapply it to the finger after it has touched the test strip or analyzer. After applying the blood samples, a beep should sound after each sample is absorbed. After the first beep, the cholesterol symbol will disappear. After the second beep, the HDL symbol will disappear. After the third beep, the triglyceride symbol will disappear. Once the symbols for cholesterol, HDL, and triglycerides have disappeared from the screen, a series of dashes are displayed. You may now remove and dispose of the capillary rod. The analyzer will then begin testing the blood sample. This should take about 2 minutes to complete. After the analysis of the blood has been completed, the results will appear on the analyzer display. If the analyzer is connected to the printer, the results will be printed automatically. Lipid profile or glucose test results can be retrieved by pressing the up arrow button while the analyzer is in standby mode. Press the up arrow button to select either the lipid panel or glucose test results. Then push the mode button to review the results. By pushing the up or down arrow buttons, you can scroll through and review previous results. Specific results can be printed by pressing the down button for 3 seconds. Quality control. Photosensor test. The photosensor should be tested with the check strip to determine if the lipid testing module is working normally. It should be tested before using the analyzer for the first time, if you have dropped the analyzer, if you have not used the analyzer for a long time, or if you suspect the analyzer is not operating properly. Testing should be done out of direct sunlight. To begin, insert the check strip and press both the up and down buttons at the same time for more than 3 seconds while the analyzer is in standby mode. If the analyzer is working properly, OOO will appear. If the analyzer is not operating correctly, ERR will be displayed. Checking the photosensor with the check strip is not a substitute for testing with external control solutions. Testing with external liquid controls. The healthcare professional should follow their facility's policies regarding quality control testing with external liquid controls. For example, control testing may be used with each new test strip lot, monthly as a continued check on storage conditions, to test operator performance, or if there are questions regarding test results. Level 1, normal, and Level 2, abnormal, controls are available for total cholesterol, HDL cholesterol, and triglycerides. Control solutions may be stored at room temperature and are good for 2 months after first opening the bottle. To begin testing, insert the lipid profile test strip and press the center blue mode button. The code displayed should correspond to the RFID code on the strip vials. Immediately press the up button and the analyzer will display the control solution symbol. In 5 seconds, the sample blood symbol will blink and you may begin control testing. When testing, dispose of the first drop of each control solution before use. Then place a drop of the total cholesterol, HDL, and triglycerides control solutions on 3 separate areas of a clean, dry surface. The normal controls should be run on 1 lipid panel strip. The abnormal controls should be run on a second lipid panel strip. Obtain a sample of the control solution by placing the tip of a single capillary rod on the drop of the control solution. Apply the control solution to the appropriate test area of the test strip using the capillary rod. First, apply the total cholesterol control solution to the total cholesterol test area of the test strip until you hear a beep. After it has been absorbed, the symbol for cholesterol will disappear from the screen. Using a new capillary rod, apply the HDL cholesterol control solution to the HDL test area of the test strip until you hear a beep. The symbol for HDL will then disappear from the screen. Using a new capillary rod, apply the triglycerides control solution to the triglycerides test area of the test strip until you hear a beep. The symbol for triglycerides will then disappear from the screen. The test results should appear on the screen in about 2 minutes. They should be compared to the ranges for each level printed on the strip vial. Testing for glucose. Coding the analyzer. Firmly insert the glucose test strip into the test port of the LipidPlus analyzer. The power will automatically turn on, displaying the code number, temperature, date, and time on the analyzer. The code on the display must correspond to the code number on the test strip vial. The analyzer automatically reads the test strip code number from the color bar on the back of the glucose test strip. Testing. Wipe the finger with an alcohol swab and allow to dry. Lance the finger with a disposable single-use lancing device to obtain a blood sample. Then apply the blood sample directly to the test strip confirmation window until it is completely filled. The blood symbol will blink when the analyzer is ready for the blood sample. After the sample is applied, the analyzer counts down from 3 to 1 while testing is in progress. The analyzer then displays the test results. After checking the test result, gently slide the ejector button forward twice to remove the test strip from the analyzer. Discard the used strip and disposable single-use lancing device appropriately in a biohazard container. Controls. Level 1, Level 2, and Level 3 control solutions are available for glucose quality control testing. Cleaning your analyzer. Please carefully read and follow the cleaning procedures